Hello, welcome to ICan Flyy. As you all know, ICan Flyy is conducting a series of lectures to empower the special needs individuals and their caregivers and parents. As these lectures are on parenting, they are helpful for the parents of young neurotypical children also. The aim of the lecture series is to discuss about the practical tips of everyday life like daily living skills, behavior, socializations, time management, work habit, etc. Today's topic is how to introduce the concept of hygiene in our children and maintain and practice them from childhood to adulthood. This topic, that is hygiene, is a continuation of the discussion of ADL skills or activities of daily living skills. It is very important for parents to understand that hygiene is a part of a very important part of life skills, so should be introduced at a young age. Now, what is hygiene or what is personal hygiene? Personal hygiene is an important aspect of keeping healthy. Aside from making one look and feel clean, it is also preventive measure of spreading disease. Personal hygiene is composed of all the daily living activities, that is keeping us clean, comfortable and disease free. For example, brushing teeth, bathing, cleaning body, wearing clean clothes, smelling pleasant, grooming, etc. It also includes eating healthy and clean food, eating properly with clean hands. So, why it is important to teach personal hygiene to our children? We have a body and an environment around our body. It is important to maintain a clean and safe relationship with the body and environment, and personal hygiene is the part of this process. So, personal hygiene is an important form of self-care. This self-care helps our children to lead a healthy and confident life. Forming good hygiene practice from early childhood can have a positive effect on our child's growth and social development. For example, a child with poor hygiene like odd body odor or who plays with spit will not be accepted by other children. Hence, will be deprived of the opportunities to learn socialization skills. He also might feel isolated and sad, which might be manifested in some other odd behavior. How to explain good hygiene to kids? Good hygiene is a habit-forming experience. Forming good habit will develop the concept of good hygiene. As discussed, personal hygiene is the way we care for our bodies. It includes many activities such as hand washing, brushing, bathing, etc. These activities again is a chain of different activities which are to be performed in a sequence. These activities are to be taught one by one and then chain into a sequence. First of all, children should have the concept that they will have to keep the body clean. So, the concept of body parts and their use is very important. Do not wait till the child learns the body part and their use. Start early. How to start? Start the routine of brushing, bathing, cleaning hands, etc. Bring it in their daily routine structure. Involve the child as much as possible, like hold the brush, wait, keep back the brush, pour water while bathing, use the soap, etc. Try to use the same set of instruction and the same sequence. While teaching the practical activities, also teach them the concept of good hygiene. Basically teaching the benefits of good hygiene like pain prevention, feel good, look good, social acceptance. To teach and explain good hygiene, The child must also know about poor hygiene, that is, to contrast between good hygiene and poor hygiene. Teach them what are the telltale signs of poor hygiene and how they are caused. For example, yellow teeth versus white teeth, dirty clothes versus clean clothes, daily dirty nails, uncombed hair, body odor, taking bath, etc. There are various methods to teach these. For example, picture description if the child is verbal, sorting poor and good hygiene pictures, match poor or good hygiene pic with effect of this pic. For example, yellow teeth is toothache, white teeth is smiling, happy face, etc. Children should also be taught practically how to prevent poor hygiene. For example, how to be pleasant. There shouldn't be any body odor. For example, taking bath, powder, deodorant, how to have clean teeth, brush, wash mouth, etc. Invent activities. Make cards of activities and objects. For example, let the child sort the activity of taking bath. What are the objects used while taking bath? Towel, soap, water, etc. Showing the picture book is also a very important and good activity for the improvement of hygiene. Social stories, either verbally or through pictures. This helps the child to learn what is to do and when to do and the consequences of the same. You can also use nursery rhymes. Create a germ model like role play. Germs coming and biting you, germs making you ill, for etc. Explain TV ads, why they are giving the ad of showing the ad of a soap or deodorant or powder, etc. Encourage positive reinforcement. Teach by doing it practically. Create and stick to your routine. Be a good role model. Child who observes the proper hygienic practice at home are likely to learn hygienic habit more easily. While teaching personal hygiene, one point should be taken very seriously. That is the sensory issues of the child. For example, if the child has tactile defensiveness, he might not be able to hold objects for a long time, or he may react to water falling on his hair or brushing his teeth or trimming nails. Check these sensory issues. Start working on them simultaneously. Also, while teaching the procedure of personal hygiene, one should always keep in mind the physical abilities of the child, particularly in the case of cerebral palsy or other physical disabilities. In such cases, use special or modified apparatus. Types of personal hygiene. It is very important for the child to know which are the areas he should be aware consciously to be hygienically clean. So teach them different areas or different types of personal hygiene, like the important ones are dental hygiene, hand hygiene. Explain when and how to clean hands. What to do with unclean hands when you are not able to clean. For like, do not wipe your dirty hand on your shirt. Body hygiene, like taking bath, cleaning private areas, toilet hygiene, trimming nails, aware of the body odor, skin care, hair care. Also very important is food hygiene, what to eat and how to eat, cleanliness of the environment, and of course menstruation hygiene. For each of these there is a procedure, and it is important that the child should know these. To teach the procedure, start with explaining the purpose, which depends on the level of the child. As mentioned, you can use pictures, social stories, etc. Give them the items, the objects to handle. Let them identify the objects required for the particular job. Have conversations about them, when and how to use. and let them play with the objects also. Let them be familiar with the objects. Personal hygiene also includes period management for the girls. Nowadays, girls know about periods visually thanks to TV ads. Teach them what will happen to her body as she is growing. Explain with pics bodies of others like mothers, sisters around her. Tell her what exactly will happen. And this happens to Ma, Didi, Masi, everybody around. Make her familiar with the sanitary napkins. The approach of menstruation management in girls with intellectual disability should be same as it is for other girls. Advice may be tailored according to the severity of the disability. Girls who can manage their own toilet hygiene can usually learn to manage their periods independently. They need preparation with information appropriate to their level of understanding. I repeat, as a rule of thumb, if a girl can learn to be independent in a toilet hygiene, she can learn to be independent managing her periods. Preparation. All girls benefit from preparation of periods, so do girls with disability. Teach them. Start with a visual schedule. Explain exactly what happens. Teach them exactly how to manage periods, from taking out the sanitary towel to disposing it. This needs lots of coordination and sequencing. Start early. Make them wear the napkin even before they start the period. Trust me, this will help them to be familiar when actually they need to wear the same. Make a visual schedule. Allow them to handle the sanitary napkin, etc. if needed, or if the child is capable to comprehend social stories. Use one. Also, do not forget to inform about the physical discomfort she might feel before, during, or after the periods. Teach them to tell you in exact words that she is uncomfortable. For non-verbal girls, teach them to point pics. Again, based on the capabilities of the child, teach to mark the calendar for the menstruation cycle. This will help her to understand the approaching date and get ready, and also anticipate if any physical discomfort. The caregivers can also remind through social stories, pics about the approaching period and the mood swings from few days before approaching date. This should be done repeatedly for at least 12 months, if possible even more. If possible, show pictures. It is a girl's understanding. If the girl understands, tell her why she is having the mood swings or the stomach ache, what to do exactly and how long it is going to last. It will help her to manage the whole process. As in any other teaching, scheduling and consistency is the key. As mentioned, make a visual chart, tell stories, use rhymes and reward. Let the child understand that he or she will have to go through a process to keep himself clean or herself clean. For both the parent and the child, this habit will help in long run. So, be persistent and consistent. Thank you.